Good evening. Thanks for joining us. As the nation ramps up vaccination efforts, health officials in Monterey County announcing that the county will be receiving a $7.3 million grant to help in their mission to provide health care for our communities. Thanks for joining us here on the CW at 10. I'm Veronica Macias. KION Stephanie Aceves with us tonight. She was at the Seaside Family Health Center earlier, which is one of those health centers in Monterey County to be receiving these funds. Stephanie?
Veronica, I'm told that anyone who comes for health services here at the Seaside Family Health Center is not turned away, regardless of their ability to pay, which is how the $7.3 million grant from the American Rescue Plan is helping those most in need.
This is a historic moment for federally qualified health centers like us.
Community health centers like the Seaside Family Health Center typically provide services to the underserved and low income, which accounts for about 45 to 60,000 patients. The bureau chief for clinic services for the Monterey County Health Department says these centers never refuse or deny services to anyone, regardless if they can pay or not. For these centers, this funding is crucial in helping to continue to provide COVID-19 related services for the community.
This funding or grant will make sure that this center can fill some of the gaps that are needed in hiring more individuals in our workforce, making sure that we improve the positive outcomes of the center, and during this time of COVID, making sure we're able to provide more testing, more preventive care, and vaccinations.
More importantly, with all of California opening up vaccines to those 16 years and older on April 15th, the grant will help funnel in supply to Monterey County.
We have seen an increase in demand for COVID vaccinations. This grant will help us to sort of increase that, increase our capacities.
With much of the discussion of healthcare centered around the COVID-19 pandemic, primary healthcare has been placed on the back burner. Bashinde says this grant will help provide some needed funding for those areas, like preventative screenings, cancer screenings, and more.
Most of the patients have been postponing their health care, so there is a pent-up demand for the primary care services.
The grant is one-time funding and will be used for a period of 2 years. Veronica, back to you.